Good afternoon, everybody. Thanks for attending UAB's Town Hall for faculty and instructors. We're going to start off with some updates from leadership, and then we'll do a Q&A afterwards. I'd like to just pass it over to Dr. Watts so he can kick things off.
Thank you. Welcome, everyone. Before we begin our town hall this morning, I want to take time to honor UAB Police Sergeant Parnell Guyton, a valued member of the UAB family who passed away last week after a very courageous fight after having developed COVID-19 in the spring. I'd like to ask UAB Chief of Police to give us some words, and I think that Anthony knew him well, and Chief Purcell will share some thoughts, and then we'll have a moment of silence. Chief Purcell.
Thank you, President Watts, and thank you for giving me the opportunity to share some brief comments on the passing of Sergeant Parnell Guyton. Sergeant Guyton's spouse, Ms. Fakisha Guyton, and their son, Andrew, are highly appreciative of the show of support from the entire UAB community. I especially want to express my sincere gratitude to UAB Medicine, President Watts, Dr. Fanani, and the President's Cabinet for your caring attitude and assistance during this difficult time. Sergeant Guyton began his career at UAB as an office services specialist with the Department of Medicine in December 1997. He was hired as a UAB police officer in June of 2004. During his tenure, he was promoted 3 times to the rank of Field Training Officer in October 2006, Corporal in October 2008, and Sergeant in December 2013. He ended his tour of duty on July 31st, 2020, with almost 23 years of service to UAB. Not only was he an exemplary officer and supervisor, he was also beloved by the members of the UAB Police and Public Safety Department and the community. We will definitely miss Sergeant Guyton and the contributions he made to our department and the university. I will now ask that you join me in a moment of silence to honor the life of Sergeant Guyton. Thank you. President Watts, let me pass it back over to you.
Thank you very much, Chief, and please continue to extend our deep condolences to the Guyton family, and in any way we can help them, we want to.
Thank you, sir.
Well, we want this town hall to keep you as informed as possible, and we will give some updates from a number of our leaders, and then we'll address the questions that have been submitted, many of which will be answered during the course of our introductory comments. I'd like to start and say we have a very comprehensive plan for return to campus, and it's the most rigorous of any university and academic medical center in the nation. We've already had our full clinical force on campus for months, and we've returned over 3,000 research personnel, and that has gone very well over these last 2 months. We continue to increase on-campus presence for many of our support areas, and we have a plan to return to campus for start of classes August 24th. Safety and health from the very beginning have been our first priority of our faculty, employees, our students, our patients, their families, and our community. At the same time, fulfilling our really important missions is vital to the people of Alabama, the people of this nation, and to people around the world whose work and health will be influenced by what we do in these coming days and weeks. Our GuideSafe platform has many tools and actions plans informed by our finest medical and public health and health informatics personnel. Data will drive all of our decisions. And you'll hear a lot more data today from speakers. The rise since July 4th of cases across the state of Alabama has finally crested. And over the last week, the 7-day and the 14-day rate of infection has decreased. It's still significant, but in our early testing of our sentinel testing and our student employee testing, we have seen a very low incidence. And so we know that we're going to test all of our students before coming back to campus. And many of our faculty employees have been tested already. And those returning to campus in August who have not been here during these last months will have the option of elective testing. So we're going to have as much data as possible. Our health check and our exposure notification apps are working well, and they're in final stages of testing, the exposure notification. But the health check is working well, and it's allowing us to keep a finger on the pulse of our employees and our students who have returned to campus. So with that, I'm going to stop and turn it over to Provost Pam Benoit, and then we'll address your questions after these introductory comments. Pam?
I'd also like to extend my welcome and thank you again for all of your efforts to get ready for the fall semester. We're now 17 days away from the beginning of the semester for most of our students. I thought it might be useful today to talk a little bit about the planning infrastructure that is going on behind the scenes. So we have an incident command committee which oversees the safety of the return to campus processes, practices, is examining data and intervenes when safe conditions are being breached. And Katie Crenshaw, who's here today, is the chair of that group. We also have a very busy and active entry implementation committee that's working through specific implementation and infrastructure issues to promote a smooth entry into campus. And Dean Lori McMahon is the chair of that committee. One of the things that she's been working on is getting the schedule ready to go and making sure that we have information available both to students and to faculty. And then we also have been working on making sure that faculty have access to the technology and understand the technology. So I'm going to hand off at this point to Dean McMahon and then to Scott Phillips in the Center for Teaching and Learning. Lori?
Great. Good afternoon, everyone. I want to extend my thanks to all of you too, all of your hard work in planning your courses for the fall, all the creativity that we have seen as you've moved your courses to a hybrid format. And so can't thank you enough. Our students will benefit greatly from all of your efforts. In a few moments, I will share with you an example schedule that a student will see and also an example of what faculty will see. I've learned from the banner team and the registrar that these will be made available to you on Monday. Cynthia Terry's team and the registrar and Daniel Jones' team and banner have done just a fantastic job in putting the schedules together. And the extra development in IT that has been needed to split the students into their hybrid classes. I know many of you have asked about how that will happen, and you will see in a few moments when I share the schedule with you, but they've been able to develop IT infrastructure that has split the students. So here is an example of what a student will see on Monday. So I'll just direct you to the middle of the screen where it says delivery mode. So here you see face-to-face for 2 classes for this student, and you see 3 classes that are in the hybrid format. And if you look all the way over to the right side, you will see assigned day. So for this student, the face-to-face classes, the student will be in class on Tuesday, Thursday, and on Wednesday. But for the hybrid classes, the student will see that their turn to be in class for the first one is on Tuesday. For the next hybrid class, they will see that it's their turn to be in class on Monday, and then the third one back on Tuesday. So this was done automatically through the banner team developing that infrastructure. So as a faculty member, you don't have to worry about making these assignments. The students will be able to see this all on their own. And so as a faculty member, if you could go to the next screen. So what you will see if you look all the way over to the left-hand side, you see Monday, Friday, Wednesday. This is what you will see as a faculty member. So what I've removed from the screen is the students' names, but you will see the students' names enrolled in your course, and you will also see their assigned day to be in the classroom for this Monday, Wednesday, Friday course. So a lot of that work has been done for you already. And so again, I know there were a lot of questions submitted about this. So students will know and faculty will know about their assigned day. So we have developed a syllabus that was reviewed by many, including Faculty Senate, that now is available in Canvas. And that part of the syllabus is about information for students about mask wearing, social distancing, and some expectations that they can expect when they're in the classroom. We have discussed in the last couple of days about eating lunch. And so what we will add to that syllabus is that students will not be allowed to eat during their lectures in the classroom. They can have a bottle of water and they can remove their mask temporarily to take a drink. Same for the faculty. I know that as we lecture, we need some refreshment. So faculty will be able to do that, and so will students. But eating lunch has to be outside of the classroom. There are spaces that students can go to, and obvious spaces outside in our lovely green space on our campus. But other places for students to go include Bartow Arena. So we're getting that equipped with Wi-Fi. So Kirk Carver's team is doing that. And there will be spaces designated with tape on the floor and chairs for students to go to Bartow for study space and to eat lunch. Same with the School of Education. There will be spaces, that school's not being used for classrooms this fall. So there will be spaces designated in that school for students to eat their lunch and study. Other spaces are the Hill Center. So we're trying to organize this, and we plan to have a system in place where we will be able to use the one-tap system to allow students to enter these spaces so we can kind of keep track of the density and the volume. So we're working on a solution there too to make sure that that information is accessible to students. So I'll stop there with my remarks, and I'll pass it to Scott Phillips. He will show you what the classroom situation will look like with the IT equipment available. Scott?
So good morning. I'm joining you from the Lister Hill Library on the 4th floor of the new home of the Center for Teaching and Learning. And I'm joining you in Zoom through the classroom technology that faculty will have access to. Currently, IT is installing this technology in classrooms across the campus so that you'll be prepared when classes begin. Some of this technology includes a camera that will follow you as you move around the room. This camera allows a faculty member to have discussions. I can hear through the speaker in the room the conversations that are happening online through Zoom, and students who are in the room will be able to be heard through the microphones as well. I can even go to the whiteboard and use a preset to focus my camera on the whiteboard and draw, and faculty will be able to draw things that students will be able to see on the whiteboard as well. You could also use the whiteboard feature inside of Zoom. The Center for Teaching and Learning, as you know, has been presenting workshops throughout the summer. In fact, over 600 faculty have participated in these workshops. Those continue in the month of August. You can go to our website, uab.edu/CTL, and find those live workshops, including one on Monday about hybrid teaching. There are also recordings of many of our workshops that are online right there from our website. If you would like to participate and experience this technology in person before class, faculty can register right now for in-person trainings on our website, uab.edu/CTL. Those in-person trainings will happen right here on the 4th floor of Lister Hill, beginning on the 18th. They'll be on the 18th, the 20th, the 24th, and the 26th of this month. When you register, will afterwards receive an email giving you information on how to safely enter the building. 5 faculty members can participate every half an hour, and we have schedules throughout the day on those days that it's available. Also, virtual versions of classroom technology trainings are being presented by the Division of E-Learning, and those are going to be beginning on the 17th. Again, on our website or on eLearning's website, you can find a link to those virtual trainings as well. Remember, go to our website. You can get all of this information, including a link to a website that's being hosted by eLearning that has the information about which technology specifically is in each classroom. You can also see there kind of how the technology will work. And so we stand ready and continue to be ready to assist you as you prepare. We're excited that this classroom technology will make it so that students in the classroom as well as remotely will be able to interact with the professors. From there, I'm going to turn it over to Dr. Vickers.
Good afternoon. Thank you for an opportunity to share on a couple of issues. One, just as regards to the medical side, our medical faculty are in many ways working harder than ever, as well as research faculty who are back in this space. The hospital itself has been above 90% occupancy, and that's including elective cases. We have had a significant number of COVID admissions that have gradually and finally have begun to come down. We've had as high as 138, and now we're down below 100. And we hope to continually do that as we discharge people from the hospital and as hopefully the caseload abates itself over time because of our interventions. So we will monitor and continually monitor that, but we're thankful for our faculty who continually work hard, as well as for the patients who need care that we're able to take care of, and the people in our community who are now trying to obey proper behavior around PPE and distancing. The other piece that I'll mention that President Watts mentioned is our reentry plan. And I will remind ourselves and the broader community that it doesn't rest on any one component. The 5 core pieces are related to robust education and training, which some may feel to be burdensome, but it's critically important for us to make sure everybody, through the work of our HR team and Alicia Jones, to have a good sense of common ground of behaviors around COVID-19. The second piece is it's inclusive of wearing masks, keeping distance, and designing the ability around density to give us the protection we know that makes sense regarding to the CDC guidelines. And so those behaviors are crucially important. In wearing the mask, we know from just too many examples of how important that is. The third part of that, as the ADPH and most national health organizations recommend, that in any organization of bringing people back or organizing at any event, a regular COVID screen process is fundamental. We're fortunate enough on our campus with Sue Feldman and Mohan Thermuli and Sarah Parkat to have an online web-based COVID screening tool under the Guide Safe umbrella, which we call Health Check. It's powerful. We're fortunate to have it. And many have experienced the benefit of it, but it is a tool that we ought to regularly, even on a daily basis, take advantage of to document our symptoms. And that data, as Provost Benoit mentioned, is one that's being accumulated and followed through our Incident Command Center. The second piece, I should say this is maybe the fourth piece, is the exposure notification app. I got to keep my numbers together. And that's the fourth component. As you know, we require the health check, but we would love to require the exposure notification app, but we won't, just for our legal parameters, but it is a powerful tool. Most of us who are involved, or anybody who's involved in contact tracing, recognizes when you get a call of a positive test and you're asked to identify who were the people you were in contact in the last 14 days, half the time people are not able to remember who those people are. And if they don't know them, they can't remember who they are because they can't tell you. This app removes that opportunity. It has the ability to notify people only of the date. Doesn't tell them who or where or time, just the date. But it can be powerful, allowing people to know if they've had a significant exposure longer than 15 minutes and closer than 6 feet, to react in an appropriate way, both to go back in and identify whether you have symptoms and to then quarantine. And then the final piece is our testing. So our entry testing, we believe gives us a fair and clear baseline for our students returning and our faculty and staff who are returning for the first time. That testing is a piece that's really been enabled by the expertise and the expansion of our pathology labs and the support of the state. A unique opportunity. Very few states have received nearly $30 million or more to be able to do this service for our community as well as for our students. And I would emphasize that as we've expanded this capacity, it quickly will transition to testing hotspots in our community. The final piece I will say is that this reentry structure is built on a robust medical protocol, really led by the efforts of our ID leadership, our employee health physicians, our student health physicians, our public health leaders, Paul Irwin and his team, and Suzanne Judd. I would say Sarah Nafsinger, Rachel Lee, Gina Marazzo, Craig Hosley, Mike Faircloth, all have participated in this model. I'll remind people that our goal is to mitigate risk. We won't be able to remove all risk, and we realize that, but we're going to do everything possible to mitigate risk. And we believe, as President Watts says, this is one of the best platforms designed in the country to mitigate risk. So those individuals have been a part of putting together their plan. We're acutely aware of what our community looks like, and it's obviously something that's in the forefront of our minds as we move forward. But I wanted to convey that the plan is comprehensive. It does require all of us to engage. We clearly want to protect our faculty and provide the best service for our students. I'll stop with that and turn this over to Sarah. Oh, let me mention one other thing before I do that, just as one final piece, and Sarah may comment on this. When we've begun our testing right now, we'll be getting close to 10,000 probably at the end of the day students. We're just at about 1.2% as far as positive. And when we've done our sentinel testing on our campus, we're right at 1% or less than 1%. And when we've tested non-COVID patients in the hospital, we're about 0.7%. So the evidence of the prevalence of the virus in our community, that is the UAB campus, remains low, and sentinel testing will be an ongoing part of our surveillance, along with a number of other parameters. That I'll stop with, and Sarah, and ask you to comment.
Thank you, Dean Vickers. That's absolutely correct. In our testing our populations that are asymptomatic, we do have a very low prevalence of disease. So that's very encouraging for us because, you know, that definitely helps us slow this thing down for sure. Well, I'm going to speak to you today a little bit about employee health, just to give you some quick updates on the things that we're doing. A couple of weeks ago, the Alabama Department of Public Health updated their isolation and quarantine guidelines. And now the Jefferson County Department of Health subsequently has updated some of their processes. We've been working with them diligently to make sure that we're in compliance with their wishes and making sure that we're working in coordination with them so that we can do the right thing for our employees. So a couple of those key changes that you'll notice are that no longer do we talk about essential versus non-essential workers. That terminology has essentially gone away now. And so now what we have is healthcare providers and everyone else. And that's really how they're handling this for isolation and quarantine guidance. So let's talk first about healthcare providers and who that is on our campus. So here at UAB, that's essentially all UAB medicine employees are considered healthcare providers. Even if they're not a bedside provider, the services that they provide are critical to us being able to provide those bedside services. So all UAB medicine employees are included in this category. In addition, our dentistry colleagues, the School of Optometry, Callahan Eye Foundation, and a few smaller groups such as the Alabama Trauma Communication Center, those are all included in our healthcare provider population. So what you can see in that group, there'll be very little change based on this new guidance from the Department of Public Health. One thing that we are rolling out is a little bit of an increased focus on work restrictions and testing for people who live with a person who's COVID positive. But outside of that, you're going to see very little change in that population. Now, for our non-healthcare providers, which is everyone else, there's a pretty significant change that we're having to implement with that population. And it's a good thing because it'll help us slow down the spread of virus. And essentially what this changes is that if you have an exposure to someone who has COVID-19, that's going to result in a 14-day home quarantine for those people. And it's regardless of whether or not you had a mask or any other type of protective gear, and it's regardless of whether or not you've had a negative test result. If you have an exposure, you're going to be quarantined at home for a couple of weeks, which right now seems like a pretty steep price to pay, because I know we have had a lot of cases in Alabama over the last month, but we really think that's going to be the best way to slow this thing down and keep us all the safest. Now, people who have symptoms of COVID-19 and get a test and it's negative, if they have not had an exposure, then those people will still be allowed to return to work. So there's definitely still a role for testing, because we want to get those people back to work and school. And then also people who have COVID-19, we definitely want to identify them so we can plug them in with treatment. So let's talk about who gets tested. In general, any employee, if you report even one symptom of COVID, you're going to be referred for testing. And that's really important, because we don't want to miss anyone. So even if you report even one symptom, you're going to get referred for testing so that we can make sure we don't miss cases. The second group that's going to always get tested is someone, if you live with someone who's been diagnosed with COVID-19. So all those people are automatically going to be referred for testing. And you report that using the Health Check app. Just a couple more things to update you on, and then I'll stop. I wanted you to know that in employee health, we've been able to onboard in the last couple of weeks 3 more physicians from our ID faculty who are working with us to help make phone calls and manage employees who have COVID-19 and handle some of the questions that come up with that. So we're really happy about that. The other thing is we've been able to bring on board several contact tracers to enhance our contact tracing ability. So that's been very helpful for us as well. The call center, finally, that does our schedules, our testing, has added some additional employees and focused them solely on managing our employee population who might report symptoms or exposures that require testing. So those are all very good improvements that we feel like are going to help us manage things. I'll close by saying this, employee health, we're here to take care of you. That's what we're here for. We want to keep you healthy, and we're here with you in this, and we're going to be here with you. Our goal is to keep you from getting infected, but if you do, we're going to be right here with you all along the way, and make sure that we do everything for you to make sure you get the care that you need along the way. I'll stop there. Thank you.
Sarah, could you elaborate on what counts as an exposure? I know there's been some confusion over what a close contact is, and I think it might be helpful to talk about that.
Absolutely. Thank you for asking. So a close contact exposure by health department definition is if you're within 6 feet of a person who has COVID-19 for longer than 15 minutes. And so for non-healthcare providers, there's no consideration about whether or not you have a mask on or a face shield or anything of that nature. Now for healthcare providers, it's different. We take into consideration the personal protective equipment, but for non-healthcare providers, less than 6 feet, greater than 15 minutes. The time frame for that is from 2 days before the COVID positive person's symptoms develop until 10 days after their symptoms develop. That's the time frame that we explicitly use to determine that.
Pam, just to mention that our classrooms are designed such that they avoid that criteria by making sure people are further than 6 feet apart, even though they might be in there longer, so that you wouldn't qualify a whole classroom to be exposed if somebody happened to test positive.
Exactly. It should be a rare event that you would have a close contact in a classroom.
Absolutely. And certainly that's the goal. You know, I think this is something that we say to employees a lot. I'll just add this is, you know, we can definitely try to influence one another's behavior, but I think we all have a level of personal accountability, and then we all have to hold one another accountable, our coworkers and our students. And it's just a culture change that we're all having to go through. You know, here at UAB Medicine, we've all been here throughout COVID and stayed here at the hospital, and it's been a difficult culture change for us to learn to do our social distancing and wear our masks. So as we bring everyone back to campus, we're going to be asking you all to do those same things as well. And I'll tell you, it's a little uncomfortable, but I think we can do it together. Thanks.
Thank you. Dr. Chris Brown?
Thank you, Rosie. And I'll say a few things about research on campus. So first of all, I'd like to express my thanks to the faculty, the staff, the students, the postdocs, and a special shout out to the research administrators for all the hard work that they've done and are doing to get research back on track. As we've called it from the start, a resumption of research operations, or R2 Ops. That began with a series of guidelines, and we initiated the R2 Ops protocols in late May. Since that time, we've had a number of labs to come back and people to come back to continue to do their research. One of the key items is the development of an operational plan that by the principal investigator that delineates issues around safe operation of the research operation. So masks, distancing, shift work, and that's a plan that's developed and then approved by the chair as well as the dean. We have almost 600 of those plans, which represents about 2/3 of our capacity of our what we would consider our pre-pandemic level, with over 3,000 personnel listed out on those plans. Now, as we continue to move forward and we learn things, the operational plans can and should be updated. As you learn things about how you work in your own laboratory, get your plan back, update it, and then get it reapproved. It should be a very quick process by your chair and then by your dean. That way we'll stay up to date. All that said, we've continued with actually record growth in terms of new awards for research. We're up 7% relative to the same time last year, which is fantastic. We're also up significantly in the number of proposal submissions that have gone in. So our faculty and administrators are working hard to get those out to the funding agencies. Our animal resources program is running at about 85% of pre-pandemic levels. So they're running pretty strongly right now. And SebLab, the Southeastern Biocontainment Laboratory, is busier than it's ever been since its opening in 2009. As you can imagine, this is where a lot of work is done on infectious diseases such as SARS-CoV-2. We have worked with our philanthropic partners, and we're able to raise the funds to support 24 internal proposals. These are 6-month, very intense, high impact proposals. We have 24 that we've been able to support. A couple of examples is the very early work on the UAB health check was supported in part through that. Risk factors related to health disparities in disparate populations related to COVID-19 in the Deep South, and diversity of human antibodies to the SARS-CoV-2 protein. Those are 3 examples of the kind of work that we're supporting. So that's internally. We also are leaders nationally and internationally. We are involved in several clinical trials, remdesivir, you may have heard of, convalescent plasma, immune modifiers. We're also part of the COVID-19 or the COVID Prevention Network, which is a national effort where we're enrolling participants in a lot of vaccine trials that will benefit of course, not only us, but nationally and internationally. And then you've heard probably, her name was mentioned earlier, Dr. Jeannie Marazzo plays a critical role internationally, nationally, and locally, along with many others. She is the co-principal investigator of the Infectious Disease Clinical Research Consortium, which oversees vaccine evaluation efforts at a national level. So I'll end with saying, we can keep this going. We can continue to grow, continue to resume our research operations if we remember those things that Dr. Vickers said. That is, if at all possible, and it is very possible and functional to work remotely. You don't have to come in. If you can do your work remotely, do it remotely. Participate in the UAB health check. And remember what we should be ingrained in our brains right now. Wear your masks, practice social distancing, and wash your hands. And as leaders and as doers, we all need to do that and exhibit our behavior for others so that we can all continue to bring UAB back to its prominence. Thank you.
Thank you. Now we're going to turn it over to Q&A, and I see that a lot of questions have already come in. I'm going to start with questions that were pre-submitted earlier this week. So to start off, there were several questions about caregiving, about faculty who have children at home, and we know that we did a survey earlier this month, and I regret not having Emily Weichel in the room, but Dr. Watts, maybe you could just say a few words about what the university is doing in regards to caregiving for families.
Sure. Well, in the survey, we found that the majority of employees have children in either Jefferson County schools, Hoover, or Birmingham City schools. And we know that Birmingham City schools and Jefferson County schools are going to be all virtual to begin with. And Hoover has a mixed plan. So a week or two ago, once we learned that, put a task force together that's been working very hard on finding options for our employees. And we are just pulling those recommendations together, and they will be shared with everyone early to mid next week. So we will have plans to help those who have no alternatives, and then we'll have a gradated plan to help others. What we've talked about also is flexibility in schedules. If someone has to teach a class on Tuesday and Thursday from 2 to 4 p.m., they need a mechanism to make sure that they have childcare during that time, and we're working toward that. But they should also be given flexibility to work on the other parts of their job during the other parts of the days and the week. So we will encourage that. Those on the clinical front who have to work for significant specific times, there's a plan that UAB Medicine is putting together too. So we're sensitive that, we know how important that is, and we want to have the university and the health system be as proactive on your behalf as possible.
Thank you. An individual is asking, as faculty, do we have the option to go 100% online instead of in person? Dr. Benoit or McMahon?
I'll start with that one. So this is a conversation to have with your chair. And we've already asked the chairs to work closely with their faculty to determine the right way of teaching a particular course. We're trying to give priority for courses that are being delivered for face-to-face and hybrid, that are for freshmen and sophomore, so that they have that kind of an experience when they first come to campus, for honors courses, for courses that, because of the nature of the discipline, really require in-person contact or a hybrid format. For example, clinical students, it's very difficult for them to have the kinds of experiences they need if they're only remote or online. So that's a conversation to have with your chair. Hybrid is very flexible. It allows for a variety of different ways of teaching. If you attend one of those workshops that Scott Phillips was talking about earlier, you'll see a variety of different ways in which you might think about that, including, for example, doing all the lectures online and then doing discussions in class in a hybrid kind of format. There are lots of different ways of thinking of hybrid. That's why it's so attractive during this particular point. Lori, did you want to add to that?
Really have anything to add, but just to restate what you already said, Dr. Benoit, about the flexibility. I know that some instructors are using those in-person classes for further discussion or review sessions or problem sets. So they don't have to be lectures. If that's the best way to deliver your content, then it's available. But if you want to use it in different ways, that's a possibility as well.
Just keeping in vein with the hybrid teaching questions, someone mentions that a recent Georgia camp, campers were sent home, and it was singing and chatting was attributed to the spread of COVID. So how would we advise discussions in classrooms? Is there any guidance?
Let me address that. That was about the worst situation you could have put people in. The counselors wore a mask. All of the students did not. All the campers did not. And they gathered in a lot of close gatherings with singing and other activities. So that's about the perfect experience to show how virulent COVID is, because about half of them got it. And so that's the opposite of what we're going to do. And we will take every safeguard and make sure we avoid that. That is also why wearing a mask and physical distancing is required. There is a zero tolerance for not doing that, mainly because you put all your colleagues and others around you at risk. We know that if an individual wears a mask and the people around them wear a mask, there is greatly reduced transmission, and there's a low probability of getting this infection. So we have got all of those safeguards in place, but at the end of the day, human behavior is going to be critical. And that's why we have been so adamant about rigorous safety measures. And we will continue to be that way so that we protect all of us.
Could I also add that another feature you may have noticed recently in doing your health check is that we now have the passport. And what this allows you to do is when you've done your health check, it gives you a clear for that particular day. So you get a green symbol that indicates that you are now clear for a 24-hour period. And so we're working through the logistics of that, but this could be very useful for faculty to know that students who are coming into their class have not reported symptoms of COVID.
And then someone asked, what are the procedures if the faculty teaching a hybrid class has contact with individuals testing positive for COVID, but all individuals are wearing face covers?
So I can take that one. So anyone who's a non-healthcare provider who has a close contact exposure will be quarantined to home for 14 days. So, certainly it's not my decision about whether or not you can continue to work from home. So maybe one of the other panelists can answer that. But certainly anyone who has a close contact exposure will be quarantined for 14 days.
Dr.
And the
Benoit,
answer to the second part is yes. So if you are not ill, there are ways, that's why hybrid again has so much flexibility. You can move that class into a different kind of format. So we fully anticipate that individuals may not feel particularly ill at certain points in time, and they would be able to continue with their classwork.
Okay, we have a couple of HR questions that came in. If we're shut down by government again, will there be more furloughs? And how do you decide who gets furloughed? Are deans and or chairs or supervisors involved in the decision making? I'm going to give that to Alan and Alicia.
Yeah, I'll go ahead and start and maybe turn it over to Alicia after I make a few comments. So at this point, we don't know what the financial, right now we're not anticipating a negative financial impact for fiscal 21 beyond the budget scenarios that we've already put out. And in fact, budgets were due from the schools today for fiscal 21. If we do have another shutdown, all options will be back on the table. And there is a very good review process that involves the leadership of the institution as well. That includes leadership of the faculty senate and of the staff council that would participate in those discussions.
Alicia, did you want to add anything?
The only thing I'll add is, because we've had this question before, is with the furlough, the previous furlough, we looked at employees who were currently listed as not working. If you remember, in limited business operation, we had those who were working on site, working remotely, and those who were unable to work at all. And those that were unable to work at all created our pool of employees that were furloughed with some additional input from leaders. So if we find ourselves in this place again, we will continue to engage the leaders in providing input into who would be available for any option, as Alan pointed out.
Okay.
Let me also make a comment, Rosie.
Yes.
We talked about earlier the faculty member potentially having to be quarantined for 14 days. We have set aside Denman Hall, which has 80 private rooms, and 2 floors of Camp Hall, which have another 20 or 30, all of them with outside entrances for safety. That's where we would quarantine any student who had that exposure. And with all the technology and the hybrid learning, they would be able to continue to take their classes, assuming they weren't so ill that they couldn't be attentive to that. So that's for the students who are living in the residence halls. And for the students living off campus, they would be quarantined as well. Through the CARES Act money and some other institutional funds, we've acquired, I think, about 2,500 or 3,000 laptops that could be loaned to those who don't have it. And we've also worked with Verizon and others to get some emergency Wi-Fi in individuals' homes who had to keep contact and they might not have the appropriate gear in their own house. So IT and provost and everyone's been working hard to make sure we've got all those options available.
Thank you. Has the UAB system established a tipping point in cases, either at the university or in the metro area in general, at which we will again go to remote-only instruction? Guess I will pass that to Katie Crenshaw and Dr. Benoit, maybe.
I can respond initially and then ask Dr. Benoit to comment as well. As Dr. Vickers and Dr. Watts pointed out, the plan for reentry is multifaceted and a comprehensive plan that includes multiple strategies for mitigating risk here on campus. And while we are monitoring our effectiveness and meeting all of those plan elements, there is not a single point, a tipping point as it was called, in which those decisions will be made. We're looking at data in its totality and offering that to leadership to make the most data-driven, informed decisions about phases of return. Dr. Benoit, would you add anything to that?
No, good job.
Great.
So, you want to add anything?
No, I think you summarized it well, Katie, in that there are multiple data sets we're looking at, modeling as well. So our head is not in the sand. We're looking at those data points in a very rigorous way. And yet we're also mindful of the data that says that, at least in our community, that is at UAB, the numbers are not very high. And we also are mindful of the number of things we're trying to do, but we're not unaware of our community. And that's why we pushed hard with our governor and others to get the mask order in place, and so that we could help slow this down. And the hospital is not at a tipping point. It's been stressed, but clearly we are mindful of those numbers as well and appreciative that they are beginning to drop some.
Great, thank you. Several questions about just safety within buildings. So I know Greg Parsons is on the line. One question is, recent research shows that airborne transmission is a significant factor in spreading the virus. What is being done to address the issue of recirculated air and airborne transmission of the virus in classrooms, many which do not have windows? So Greg?
Thank you. Well, one of the first things, of course, is, as we mentioned, wearing masks. Think of your mask as your personal air filter. You're reducing the quantity of matter that's in the air. Another issue is the spacing out of students, so you have lower density. Classrooms were designed for certain amounts of air per person, and by cutting the occupant load, you've in essence increased the amount of fresh air per person. None of our buildings are without fresh air. Some of our laboratory buildings are 100% outside air, so therefore there's no recirculated internal air. The vast majority of our buildings have 10 to 20% fresh or outside air. We're using the highest filter media possible. And as an example, if we look at a typical 1,000 square foot classroom that ordinarily would hold 40 to 50 people, there'll be 20 to 30 people in that classroom. In addition to that, the air supply system delivers approximately 60,000 cubic feet per hour to that classroom space. That's a lot of air, a lot of dilution, a lot of fresh air. So we feel like we've got the systems in place. We've checked our filtration, we've checked our outside air, we've checked our exhaust. So we feel comfortable that we're providing the best air systems that our systems can deliver to the various classrooms.
Greg, would you want to mention just some of the safety features you guys are installing in common spaces and the hand sanitizers?
Right. So we've installed a lot of refill stations so people can refill their personal hand sanitizers. We've just gotten a recent influx of individual, smaller size dispensers that will be brokered out and dispensed or distributed out to the campus. Lots of signage has gone in place to encourage social distancing and spacing and safe practices. I think that's the majority of it, Rosie.
Yeah, thank you. Some folks are asking about, will employees be tested? So I might pass that over to Alicia. I know we've got some communications going out about testing, and then Dr. Vickers.
Okay, thank you, Rosie. And well, Dr. Vickers, you want to go ahead and go first?
Yeah, so employees are tested in two fashions. There's a selected group that Trustee Provost Benoit and Vice President Bolton have selected for those coming back in the August period. And then there is a segment of every individual on our campus given an opportunity through a randomized process to be selected for sentinel testing. But that's employees, faculty, and staff. The unfortunate thing is that we've not had the full complement of people accept that opportunity. So our goal is to test somewhere between 2.5% to 3%, and we solicit for 4 to 5% of our population, and we get low numbers. We get less than 2% participating. So where I really would encourage all of us is, if you get that email to participate in the testing, please do sign up. It's not the nasal pharyngeal swab. It's just the anterior nasal swab. So you self-administer it, and it's not terribly difficult, but it is a good biopsy of the prevalence of the virus on our campus when those individuals participate.
Thank you. Alicia, did you want to add anything?
I will just add that for the optional entry testing, as Rosie mentioned, there's a communication that's going out today to anyone who is not already on site in a full capacity or in a hybrid capacity. So anyone who is currently identified as working remote now and not working on site will receive the information about optional testing. What we will ask is, we recognize that some people will continue to work remotely longer. And if you have not been assigned a time to return to campus, that you not participate in this optional testing at this time, just for volume, and so that we can manage it for the people who are coming back. But you'll receive that communication later today.
Great, thank you. Lots of questions about syllabus information. Is there banked information? Lori, I'll pass that on to you.
Yeah, great question. And I saw those in the chat. So there is a syllabus that is available in Canvas, and the question has been, where is that located? I unfortunately don't have that answer for you right now. Dr. Pam Postian uploaded it to Canvas. So as soon as we have that information, we will make that available to all of you, so you know exactly where to find that.
Must students come to campus on their day for hybrid learning, or can they choose to stay away and participate from a remote location instead?
So I can address that too, and Dr. Benoit, you can add in. So the faculty set the attendance policy for their course. So if you have an attendance policy where you require your students to be in person on their day that they are assigned, then the students should show up on that day. If your attendance policy does not require that, then a student can choose to engage remotely if they wish. And so the reason why we've developed the curriculum or the courses in this hybrid way is to allow students to have that flexibility in the case that they become sick or are not feeling well, that they can stay at home and engage remotely.
I also just got information from someone else that the template, the syllabus template, when you go into Canvas, you just click on syllabus and it comes up.
Great, thank you.
Thanks for that. That sounds easy, so good.
I would mention along that lines, when we talked about the passport, if you do that before you leave home and you have a symptom, it will tell you to stay at home. Don't come if you're not feeling well.
Okay. An individual asked, would an employee who was diagnosed with COVID be required to test again after the end of symptoms and before they return to work? Dr. Nafziger.
Yeah, thanks. So previously, the CDC had recommended a test-based strategy for returning people to normal activities. But since that time, they've kind of pivoted away from that, because what we found is people will continue to test positive for an extended period of time, even after they're no longer infectious or no longer contagious. So current recommendation is that we used a time and symptom-based strategy, which is the preferred methodology. We've actually been using that for employees and employee health for several months now, because it just made more sense to us from the beginning. And we found that to be a safe methodology that we use. So no, we do not require a negative test before returning to normal activities. And I'll tell you a little bit of the logic there is that what they found is that when they culture the virus from people that test positive for a prolonged period of time, it's not viable virus. So it's kind of dead virus, if you will, that can't transmit disease. And so that's the logic there. Thanks.
Try to squeeze in another question here. Must teachers wear a mask while lecturing? Is face shields without a mask okay? Dr. McMahon?
Yes, face shields are okay. And I would just remind you to maintain that 6 feet social distancing. So instructors of records will receive 2 cloth masks and 2 shields. And so an instructor can decide on their own whether they prefer the shield or the mask. But just again, to remind you, the 6 feet social distancing is really important to keep you safe and also your students.
And I also point out that you may have noticed that Dr. Phillips was wearing a face shield as he talked with you today. I know there was also a question in the chat about, are face shields really safe? And we spent some time talking with our healthcare experts who came back and said, as long as you're maintaining the 6 foot distance, face shields should be sufficient. Of course, this is your choice. You could wear both. You could wear one or the other. It's up to you what you want to wear.
All right, we are close to the end of the hour. So just to remind everybody, we are recording this session. So look in a future upcoming e-reporter and we'll have any questions that were answered, that was asked that are not answered, we will follow up and answer those questions. So look for that in the e-reporter. With that, I'll just ask Dr. Benoit and Dr. Watts if you have any closing remarks.
So I would just say again, I want to reiterate our thanks. We know that this is a bit of a topsy-turvy beginning to the semester because things are ambiguous, but I know that everybody is trying so hard to make sure that we provide a quality educational experience to our students. And we thank you so much for your efforts to do that and to be part of this team that makes sure that we are one of the safest campuses in the country.
I would echo that. I want to thank everyone for all of your contributions, but also I hope that you can hear from the comprehensive and rigorous nature of every aspect that we've considered. And we continue to consider that we intend to keep our UAB community very safe. And we encourage everyone to help one another make sure we follow these basic safety guidelines. So thank you all. And this is for your information, and we'll follow up with those questions you asked with answers that didn't get addressed during the session. Have a good day.
Thank you.